Um, Doctor, we're getting different questions coming on. We're almost at an hour. How is your time? Are you still
My
good?
time's fine.
You're still good? And Jay, are we still all right to go on? Jay? I don't know if you're hearing me, Jay. Okay, so I want to.
Yes, we're good. We're good. Keep going.
Okay, Doctor, I just want to put a personal anecdote in here. Just on the point you just made, I had some blood work done just about a week ago, and I saw my cardiologist, as it happens, this week, and she was a bit alarmed that my triglycerides had, gone way off from my normal base, and she wanted me to go to the lipid clinic and have it assessed. And now you've just answered the question. I had been taking the M for the first 2.5 months of using the Emulin, and intuitively I decided to switch to C just a few days ago. That would explain the release of all those triglycerides into my blood system over the last little while, probably.
That is the difference between M and C. M has a lot more quercetin in it.
Yeah.
It's for people that want to have more energy. They want to lose more weight.
Yeah.
But the C is our original formula, right. And that's in order to keep those triglycerides and blood sugar lower for people that have those concerns. Yeah. I would like to point out that, and anyone who is keeping astride of science in this area will know that there is no connection between triglycerides and any heart event. There's no connection at all. Cholesterol, the link between cholesterol and any heart event is also a fabrication. And it first came out in the British medical journal Lancet 2 years ago. They reviewed the original work done by the person who's now deceased, who was the president of the American Heart Association. It was absolutely deceitful science. And they were just trying to get themselves in a political position. They had analyzed the diets of 14 regions around the planet, and they reported that high cholesterol and triglycerides were linked to cardio events, negative cardio events. Well, we found out later and revealed about 2 years ago, he picked the regions that made that true. So he only included 7 of the 14 places he studied. If he had included all 14, there was no causal relationship. Cardio events are linked to carbohydrates.
Well,
that's it. If you lower your carbohydrates, your whole chemistry will improve.
Well, Dr. Ahrens, you're making, for some people, these will be very provocative statements. I happen to have come to that same conclusion after all the reading I've done, but more importantly, somebody as eminent as Dr. Dwight Lundell, who wrote The Cure for Heart Disease and is a very enthusiastic promoter of the Emulin product with you, he was kicked out of the medical profession after 30 or 40 years of really important work, opening up over 5,000 different hearts, and he came to the same conclusion that the damage done to the interior of the arteries of the heart, all the atherosclerosis that he saw, that was not caused by cholesterol, and it wouldn't be improved by statins. It was all because of the sugar, the effect of the jagged edges of the sugar molecules, creating nicks in the intimal endothelial layer, and then triggering massive inflammatory response, and therefore the macrophages and the white cells, and therefore the plaquing. So you're definitely speaking to the converted here when you tell us that. But it's very important news when we see the massive amounts of money that the pharmaceutical companies are making on all the statins, and how the doctors push statins on almost everybody. In fact, at one time they even thought of putting it into the water supply because they were convicted that people everywhere should have this to control heart disease. So what you're telling us about the Lancet study, if you can send me the link to that study, I'd be very much appreciated, and I'll share it with the group.
Okay, I can do that. So I think that it'll take about another 5 years, maybe 10 years. It's going to be tough because it's basically political. The food pyramid is stupid. It's better than it was 20 years ago, but it's still ridiculous. And, my small company here, we've actually gotten threats from some mega companies. They're going to bury us.
Yeah.
And, I'm 65. I've run the race, and go ahead and bury me.
Yeah.
But if I could, I run a drug company here, but the FDA is also out to bury us because it's the fox that is in the hen house. And I don't like to talk about the negative aspects, but I can send you those links by the world's most respected journals, and we are finally coming to understand the original work was a lie, and there is no link between these products and heart events. It's just to sell Lipitor, the #1 prescribed drug in the world.
Yeah.
So it's kind of irritating to me. And as you mentioned, the good doctor almost had his career destroyed. He was an eminent heart surgeon, and he saw that the problem with heart attacks and clots was due to inflammation. And the inflammation is coming from refined carbohydrates. Why is that? It's because, one, we eat too many of them. We have things like high fructose corn syrup forced upon us. And we also do not pay attention. Most people do not have good diets. Number two, and this is why I'm in the picture, we have discovered that these so-called vitamins that we have found are supposed to be in everyone's diet. So people say, well, should this person or should this young person take it? Should an older person take it? And what if they have arthritis? What if they have asthma? Well, my answer is, should everybody take vitamin D? Should everybody have enough vitamin C? Should they have enough vitamin A? Yes, and they should also take Emulin. Everyone needs to take Emulin. I know I sound like a salesperson there, but it's actually, I'm a scientist who has found out here's something we need to all have in our diet, and we cannot get enough. There's no way you could eat enough of today's blueberries or today's oranges or pineapples to get enough in your diet, because the foods just don't have enough of it anymore. So it is a true supplement that you need to have for good health.
Well, that's pretty powerful stuff, and I'm glad that you're a spokesman, not only for your product and the company that you head, and also I'm sure the research that you're doing in conjunction with Holista Coltech, the company that's co-owned by the chairman of Galen and the president, Hang Cheng Fei, and Dr. Rajan. Would you like to spend a minute or two telling us about some of the new things that are coming in that regard, some of the research that you guys are doing and products that we may see in the near future?
Yes, well, we, as I mentioned, type 1 diabetes, type 2 diabetes, and type 3 diabetes. I encourage anyone just to Google that, type 3 diabetes. It'll pop up, Alzheimer's. We, the scientific community, have come to figure out that the tangles in the brain, the tau proteins, and the beta secretase, they are just symptoms of the disease, which is dysfunctional carbohydrate metabolism in the brain. So we now are coming up with a product to tackle type 3. It's very similar to the Emulin product, except it's been formulated to cross the blood-brain barrier. There's the key right there. So we have, it'll be Emulin for the brain. And our preliminary investigations have actually the preclinical work, because, you know, this costs like millions of dollars to do this work. And so we have to first do preclinicals to establish that it's worth doing. Our preclinical work has reversed Alzheimer's in several patients. People that have forgotten how to talk, which is called aphasia. They are starting talking again. They start recognizing their family members. So we're very encouraged. We're not going to come out and call it a cure for Alzheimer's. We're not going down the drug route. We think everyone needs to have this in their diet. We're going to just call it, you know, brain health. But that's going to be available very soon. It is right now in the process of passing the regulatory hurdles in Canada, US, and Southeast Asia.
Well, would a product like this with its components, just because you mentioned aphasia, a person who has had a massive stroke in his speech center, somebody who was able to be an orator to 10,000 people before, but now cannot say more than 2 words, and this is 5 years later, would it have any effect at all, or is that brain area gone for good?
It depends if it was due to like a starvation of oxygen where the brain tissue actually died.
Yeah.
That would be the difference. Yeah. If the tissue has not actually died, there's hope for restoration. But if it's been too long, yeah, and the tissue died because of, for instance, a lack of oxygen blood supply to that part of the brain, no, it's not a miracle.
No.
But it can reverse. Before it gets to that time, yes, it can be reversed.
And I'm having a question thrown out here about Parkinson. Would it help somebody at all with Parkinson's?
Yes.
Oh, really?
Because these flavonoids protect the nervous system, which includes the nerve bundles. And a lot of these diseases are they are actually a disease that has been caused by an inflammatory response. And eventually the body stops processing the signals at the synapses correctly. And so we can actually reduce the localized inflammation. It's mostly through the action of miricetin. And those signals across the synaptic gap will become more normalized. The problem with Parkinson's is you're basically having a short circuit. And you have a feedback mechanism where the signal going across the gap just goes in a cycle and it won't stop, so you can't really control it. It's actually a simple disease, but there's no real cure. But any of these diseases that have an inflammatory part of their initiation, which are 60% of diseases on the planet, you name it, asthma, psoriasis, they're all due to autoimmune responses, which are part of the inflammatory cycle. It's an inflammation that just gets out of hand. So we have given Emulin to people, even back in those old days when there was just that powdered grapefruit I told you about. People would take that product and then come back and report their psoriasis had cleared up. And it was because of these flavonoids. Again, everything I'm saying here is well documented. You can just go to PubMed and put in psoriasis and flavonoids, and there's 100 papers that pop up. People have done this research. They just didn't put the dots together. They didn't connect the dots, and that's just what we've done. We're not geniuses. We just connected the dots through about 10 years of computer simulations and a few clinicals. Our first clinical was a human, and I told you it was a disaster because we had too much quercetin in it. And then we regrouped, and we did type 1 rats, which had no functioning pancreas. So not only did they survive not having a pancreas, but they became non-diabetic. And then we did type 2 humans. We have a study that was a much larger study of around 100 individuals over 3 months. It was done in West Virginia by a doctor who saw the possibilities of this being good for his community. This test, it's almost finished. We hope to have that data soon. And now we're starting the Alzheimer's, I don't want to call it Alzheimer's, just say brain health study, which I know during all of this, there will be people reporting reduced asthma, reduced psoriasis, reduced IBS, better bowel movements, because these are all influenced by inflammation.